breath in. Go as you can. Snap.
From a baby's first breath to a palliative care patient's last, respiratory therapists can be involved in caring for patients at any stage of their life. They are also on the front lines of battling COVID-19. This year, these medical professionals have had to adapt to a constantly shifting health landscape, overcoming many challenges, according to these two RTs.
When COVID first reared its ugly little head, we definitely were unsure of what we were dealing with. So we really had to, the day-to-day was adapting every single day, new policies coming out, new information, and putting that into our daily practice right away was a really important thing. The extra protective gear they have to put on before going in, the cleaning they have to do afterwards. Certain types of machines that we used to use may or may not have been safe. And now we've had to look at a different way to make sure that we provide oxygen in a safe manner to people.
Not only have they adapted their care for patients with ongoing breathing difficulties, but they've been caring for COVID-19 patients too.
Whenever a patient is requiring a higher level of care, whether that be because they're oxygen or is climbing, or there's something that requires them to need a breathing tube, respiratory therapists are part of putting those tubes in to have the patient put on a ventilator. So working with other disciplines within our hospital is really important for these patients because it's not just our side of the picture. Making sure that their body positioning optimizes how their lungs are working, ensuring that their bronchial hygiene is working. So chest physiotherapy, hydration, dietary, all of these things tie in together to optimize a patient's health status so that they can fight COVID.
For ongoing care of other patients, they say offering online resources has had some unforeseen benefits. The Better Breathers Facebook group, put on by the BC Lung Association, is open for those with a chronic lung condition and their loved ones.
And there's a volunteer, myself, a respiratory therapist, and there's a physiotherapist on there. And you can ask your question. It's been pretty amazing to be able to help reach these people that that maybe have fallen through the cracks in the past. A lot of these people don't have access or live close to be able to have access to an RT. I think that it's so rewarding to be able to provide education to people on the internet.
These RTs say they are proud to be part of teams helping patients through a challenging time in healthcare.
RTs should just know that across Canada, how hard you guys are working and just how amazing and how much support you have with everyone, that you're appreciated everywhere. Yeah, they make us proud to be an RT.
For Castanet Kamloops, I'm Kristen Holiday.